This is Preeti and you're watching my solution. In this video, I'll be teaching another important question from the pharmacology, that is sublingual route. Sublingual route means we keep under the tongue. This is an important question and has been asked in many times in the university exam. In this video, I'll be discussing about the advantages, disadvantages, and examples for sublingual dosage, the drug. That is sublingual means sub means below, lingual means tongue. Below the tongue we keep these drugs. This is kept under the tongue. It can be these drugs are easily absorbed into the vein, that is deep lingual vein, which is present the ventral surface of the tongue. If this is a tongue, this is a dorsal surface and this is the ventral surface. Here frenulum will be there. Adjacent to this frenulum, on both the sides there will be deep lingual vein. The drugs are absorbed directly into the deep lingual vein, through which it enters into the bloodstream. It is kept under the tongue. It is absorbed through the buccal mucosal membrane and then enters into the deep lingual vein. It enters through the deep lingual vein. It enters systemic circulation directly. Examples for these sublingual route of administration, the drugs which are administered through the sublingual route is nitroglycerin, which is for angina pectoris during heart attacks, acute chest pain. The nitroglycerin are directly kept under the tongue so that for the quick action and quickly relief of the pain. Nitroglycerin used for the angina and buprenorphine, and that is opioid dependence. That is also during opioid dependence this drug is used. Advantages of sublingual drug means that they have quick onset of action as they enter directly into the bloodstream, so need not to go under the GIT and then get absorbed. So they have quick onset of action of drugs, and this action can be terminated by splitting of the tablet from the mouth, and it bypasses the fast pass metabolism, as no metabolism in the liver or any other places takes place. So it directly enters into the bloodstream. It bypasses the fast pass metabolism, and it is self-administered. We can easily keep. We need not require any others' help. These are the advantages of sublingual route, that is quick onset of action, and the action can be terminated by just splitting of the drug, and it bypasses the fast pass metabolism, and it can be self-administered. And disadvantages will be, it will be suitable for the drugs which are irritants and which are not pleasant taste, which doesn't give pleasant taste. For this they are not suitable for the unpleasant tasting and lipid insoluble drugs, because it has to cross mucosal membrane, which is a lipid membrane. If it is not lipid soluble, it cannot be taken. Lipids lipid soluble drugs only can cross the mucosal membrane. So the disadvantage is insoluble drugs cannot be taken, and the irritants cannot be taken, and the bad tasting things, because as we have to keep into the mouth, that is under the tongue, because of the taste buds we cannot take the bad sensitivity of the taste buds, we cannot take the bad tasting thing. And infants and children which are under 5 years, they cannot, they don't listen to our things and then instructions, so they may move away from the sublingual thing. So this is not preferable in infants and children. These are the things which we have to write in sublingual route. That are examples, advantages and disadvantages. Where it is kept under the tongue, through buccal mucosal membrane. It crosses and then enters into the circulation directly. Nitroglycerin, which is used for angina, acute chest pain, and buprenorphine, opioid dependence. Advantages will be quick onset of action, and it can be terminated by just splitting the drug, and it bypasses the fast pass metabolism and self-administered. Need not require any other's help. Disadvantages are irritants, lipids or insoluble drugs, and then drugs which are with a bad taste and cannot be taken through the sublingual route. And infants and children, we cannot prefer this route. These are the disadvantages of sublingual route. Thank you for watching.